Hi everyone, I am Dr. Satyasri, consultant obstetrician and gynecologist, Ankura Hospitals, LB Nagar. Today we are discussing about women health checkups. All the women love to go for their regular health checkups, even though they are little apprehensive about it. But why is this significant? Why do we need women health checkups? Why is it so important in our lives? The first check for any woman, for any health regard she has, is pregnancy. During the pregnancy, all her health ailments will be checked upon and treated accordingly. But what after pregnancy? The woman is totally immersed, neglecting her own health in the upbringing of their children and the family and in her work schedule. In due course of time, a smaller indications what her body might be giving regarding future health problems, she might be neglecting that or might be missing that also. Women health checkups are especially necessary when you have a family history. If any of your family members have a chronic ailments like hypertension, diabetes, any gynecological related problem or cancers, you need to go for a regular health checkup so that all those problems can be dealt in an easier way. What are the main issues which are dealt in the women health checkups? Mainly chronic diseases like hypertension, diabetes, obesity, then your hyperlipidemias and cancers. Nowadays, everyone have their health insurance which prompts them to go for a health checkup, where that is the first time when they go for a health checkup. Otherwise, if they have a family history, they're apprehensive about it and then they go for a health checkup. These days, many of the diagnostic centers are promoting their health packages in a very rampant way to prompting everyone to go for a health checkup. A prior appointment with your physician or a gynecologist will guide you so as to which health package would be suitable for you. As in gynecology, whenever a woman walks for a complete health checkup, we do a thorough head-to-toe examination of the woman to diagnose any anemia, any thyroid goiter, the breast examination for any lumps, for an abdominal examination for any tenderness or masses in the abdomen, any lymphadenopathy either in the axilla or in the groin. And what about the legs? Any varicose veins or any dependent pedal edema. This completes a head-to-toe examination of a person. Along with this, vital parameters like her BP, blood sugars, and also the respiratory and cardiovascular examination also will prompt for deciding a suitable package for a lady. We usually suggest a regular ultrasound examination once in a year and regular pap smear and HPV DNA screening once in every 3 years. That is a recommendation we follow worldwide. Along with this, breast examination has to be done in every health checkup, and an ultrasound of the breast has to be suggested for all the women who walk in. What are the recommended health checkups in case of gynecology? We usually suggest a breast examination followed by an ultrasound screening of both the breasts if the woman is below 45 years, and if the woman is above 45 years, we usually suggest for a mammogram once in every 3 years. If at all the woman has a family history of breast cancer, then we start mammogram as early as 35 years. Along with this, we also advise for ultrasound whole abdomen and pelvis to look for any masses or any abnormalities in the abdomen. This is accompanied by a pap smear and a cervical screening. Along with that, a HPV DNA also has to be taken once in 3 years to rule out any cervical cancers. When an internal examination is done during this package, it will also help the clinician to diagnose any genital infections you have and promptly give you treatment so that you can be treated immediately. Regular health checkups also ensure you to keep your BMI under control. They give you a diet and exercise regime, and also to keep your waist-hip ratio under your control. Along with this, other lab parameters like complete blood picture to assess your anemia or any other thrombocytopenia parameters, and a urine examination, your liver function test, a kidney function test, along with your thyroid profile will complete your lab parameters for your health checkups. Do speak to your clinician before you enroll into any health package so that it gives you a complete idea about which package you have to go for. Get your health checkups done promptly so that you can prevent yourself from future chronic health ailments and future cancers. Stay healthy.